Hello everyone. As you already know, I'm Dr. Ivanov from Heart and Brain Hospital in Pleven, Bulgaria. First of all, I would like to thank to Dr. Vasilyeva for the kind invitation. It's really big honor for me to be here and to have the opportunity to speak in front of you. It will be very big challenging to speak after such a nice presentation, but it will be some kind of easy because I believe that we are more and more convinced in the safety of sentinel lymph node biopsy after this presentation. As we already know, and I believe that we know, we still owe a lot to our patients according to the sentinel lymph node biopsy in Bulgaria. And I believe that such an events like this will lead to more and more spreading of the sentinel lymph node biopsy in Bulgaria. So, once again, thank you. We'll go through briefly history view of the sentinel lymph node biopsy. Actually, we all know that the lymphatic status of the axilla is one of the most prognostic markers in patients with breast cancer, and the presence of lymph node metastasis in the axilla leads to reduced 5 years survival rate. Until the last 2 decades, the full axillary lymph node dissection was standard for most of the teams in Europe. Unfortunately, many teams in Bulgaria still believe that this axillary dissection is a standard procedure for all of our patients. And we found that more than half of the patients with axillary dissection will lack data for metastasis in the lymph nodes. On the other hand, the axillary dissection leads to more complications like bleeding, seroma formation, and lymphedema, which is, I believe, very important condition which can be very worsening the life of the patient. So we saw that the price of the axillary dissection is very big, and sometimes the patient should not pay the price for it. And we can make the conclusion that the axillary dissection for many patients will be over-treatment and it should not be performed. For these reasons, it was developed the sentinel lymph node biopsy. It was performed many years ago. The sentinel lymph node biopsy is based on the hypothesis that the lymph node metastasis in the axilla occurs through the lymphatic channels in the early stage of the disease in the so-called sentinel lymph nodes. As we can see here, the benefits of the sentinel lymph node biopsy are the less trauma, the ability to perform it under local anesthesia. It can be performed even like outpatient procedure, and the lower rate of post-operative complications. The most important is that it does not lead to worsening the oncological outcomes of the patients. Here we see the 2005 guideline of ASCO. They recommend the sentinel lymph node biopsy in all clinical negative axilla patients, and they say that in cases of positive lymph nodes, we should perform axillary dissection. It's 2005 and 2014. They do another recommendations. Even in cases of 1 or 2 metastatic lymph nodes, we can omit the axillary lymph node dissection and perform only sentinel lymph node biopsy. And here we come on 2022. This is the NCCN guideline. They recommend sentinel lymph node biopsy in all patients with 1 or 2 positive or less positive lymph nodes in the axilla, which are planned for breast conserving